So guys, next we talk about the blood vessels in the head and neck. Uh, Again, to remind you that the reason we are following this sequence is the first thing we discussed was the cranial nerve nuclei in the nerves. Once you know about the nerves, which also includes the parasympathetic ganglion and innervation to the gland, we then moved on to the deep cervical fascia so that we can understand how exactly the structures in the neck are arranged in the different layer of the fascia. Next thing we did is that cranial dura mater and dural venous sinuses. And the reason we discussed the dural venous sinus first, before we discuss the blood vessels of head and neck, because now when we talk about the venous drainage in the neck, now we already know how internal jugular vein is formed. We already saw sigmoid sinus and inferior pectoral sinus was forming the internal jugular vein. So we can talk about the internal jugular vein and the external jugular vein also. In the blood vessels in head and neck, our main focus will be on the major branches of external carotid artery. There are 8 branches of external carotid, and we'll be discussing few of them in detail. Followed by that, we'll talk about the branches of the subclavian artery as well. And in between, we'll also look into the venous drainage of the face along with the arterial supply. So in the blood supply, blood vessels of the face, the two major blood vessels we have to take care of. One is the external carotid artery and subclavian artery. And the subclavian artery. Obviously, internal carotid artery is to be discussed in the neuro part. So we are discussing ECA and subclavian. So let's start our discussion with the ECA first. Well, guys, external carotid artery in the neck, it gives off 8 branches. We have 8 major branches, and there are loads of questions on them, direct, indirect. External carotid artery got 8 branches. I'm going to write the name of these branches first, and then we're going to discuss it with the help of a simple diagram that which triangle or where we are expecting to see these arteries. The very first artery we'll see, that is called as the superior thyroid artery. We've got a superior thyroid artery. Try to write them in this sequence because there's a reason I'm writing them together. Superior thyroid artery, lingual artery, facial artery. Lingual artery, facial artery, and superior thyroid. Now, what is the common thing between the first 3 arteries that I wrote here? All these three branches are grouped as anterior branches of external carotid. These are the anterior branches. These are the anterior branches of external carotid. So when you see the neck dissection, you will see these 3 arteries are running forward, anterior branches. The fourth artery I'm writing here is called as ascending pharyngeal artery. Ascending pharyngeal artery. We just saw the meningeal branches of ascending pharyngeal. Ascending pharyngeal artery is the only branch of external carotid which is present on the medial side. Now imagine if this is external carotid artery for my right side, you can see the anterior branches, you can see the posterior branches, but you cannot see the branch which is on the medial side. So it's like present on the medial side of main external carotid. So in fact, it is the only medial branch. It is the only medial branch of external carotid. There's no other branch on the medial side. That's the only medial branch. Moving on to the next 5 and 6, that is the occipital artery. And then we have posterior auricular artery. Posterior auricular artery. Now, what's the special between the, as you can make out with the name, guys, occipital obviously must be going behind toward the occipital bone. Posterior auricular is again behind the auricle. So the two branches going in what direction? Posterior direction. So these are the two branches which are given off posteriorly. These are called as the posterior branches of external carotid. These are the posterior branches of external carotid. And finally, the two terminal branches, the two last branches of external carotid which are seen here. One here on the region of the face and one which is going to the temple region. So that is the maxillary artery. We got the maxillary artery and we got superficial temporal artery. maxillary artery and superficial temporal artery. These two are called as the terminal branches. They can formulate the question any way they want. They might ask you what are the terminal branches, which one is the medial branch is already been asked in, it's an AIPG question, now so-called NEET question, the medial branch. So we have these 8 branches of external carotid, 3 anterior, 2 posterior, 1 medial and 2 terminal branches. A little bit of more information here. Like superior thyroid artery, please note it is the first branch of external carotid. It is the first branch of external carotid artery. Few says ascending pharyngeal artery is the first branch, but no, that is just a variation. It's a first branch of external carotid is superior thyroid artery. Okay. What else? Maxillary artery is the largest branch. Maxillary artery is the largest branch of external carotid artery, and there should not be any confusion about it. See, external carotid artery is having how many? 8 branches. Imagine maxillary artery alone, which is a branch of external carotid, is having 16 branches. So you can very well imagine how huge maxillary artery is, and it's an important artery because it is supplying the structures inside. We're going to talk about it. So out of these arteries, the one which we're going to discuss in detail, one is the facial artery we have to discuss in detail, and one is maxillary artery, the largest one. You should know the names of other arteries, but these 2 arteries should know their branches, their cores, and some clinicals also. But once again, before we start with the facial and maxillary artery individually, I want you to understand these arteries in the next section, so that when you look at the real-time picture or the atlas image, you can easily identify these arteries there. So I'm going to draw the side of the neck for you, and then we'll try to understand how exactly these arteries are running in. Okay, how will you understand how the side of the neck is? When you turn the head to one side, for all the triangles of the neck, this is the upper part here, which is found by the base of the mandible. Like here's the base of mandible. Then we have external auditory canal. We got a mastoid process behind it, and then the occipital bone. So the 4 major bony landmark there, and below we have a clavicle and manubrium, right? So if this here is the mandible, this is mandible, let's say, this is external auditory canal, that is the mastoid process, and here we have occipital bone. We're going to draw the same kind of diagrams in the triangles of neck also. Mandible, external auditory canal, mastoid process, occipital bone. Let us say this here is the anterior midline. There we have the posterior midline. And here we have the manubrium and the clavicle. There it is. Okay. I hope you're getting oriented to this. That's how when you turn the head to one side will look like. Got a mandible, external auditory canal, mastoid process, and occipital bone. Anterior, posterior midline of the neck you can see, and then below obviously clavicle and manubrium bone. The main muscle which I need to put here is the sternocleidomastoid. So there we go. This is the sternocleidomastoid muscle. No fancy diagram needed. This we are using this diagram just to understand the branches of external carotid. Then the muscle which is having an attachment to hyoid bone. So we have a posterior belly of digastric, which is present somewhere like this. This is a posterior belly of digastric. And we have superior belly of omohyoid like this. Posterior belly of digastric and superior belly of omohyoid. Just for your understanding sake, I'm going to stretch this diagram separately so that you can write the name of the muscle. This is sternocleidomastoid. This one here is the posterior belly of digastric, and here we have a superior belly of omohyoid. That's how. We don't want to spoil this diagram here, so I'm just writing it separately. That's sternocleidomastoid, posterior belly of digastric, superior belly of omohyoid. This triangle which I'm highlighting here, as I said, we're going to discuss the details of this triangle a little later. This is carotid triangle. And obviously name suggests carotid triangle because we have a carotid vessels inside. Carotid sheath, carotid vessels are inside. Common carotid artery, when it comes inside this triangle, obviously it divides into internal carotid and external carotid. So let's say this is internal carotid. We are not bothered about it right now. And then we have this external carotid artery which will go up. It will go up like this. And what you will see, this will keep on ascending upward in front of the external auditory canal. The way it reaches the face, see all these little details in the schematic diagrams are very, very important to even identify them in the real-time section. carotid triangle they are running. They are running in the other triangle above. That triangle is called as the digastric triangle. We'll see that. But remember how it goes to the face or how it goes into this region? In front of the auricle, in front of the external auditory canal. So that is what artery? That is external carotid artery. This here is external carotid. The first branch of external carotid, superior thyroid artery. And along with superior thyroid, guys, we said we have two more anterior branches. So we have in total 3 anterior branches. Now this is superior thyroid artery, which you'll see coming like this and going anteriorly, obviously toward the thyroid gland, which will be somewhere there only. The second branch that you'll see will go like this above towards the tongue. That has to be the lingual artery. And third branch, obviously the tortuous artery here, which will run on the face. This is going to be the facial artery. It's a facial artery. 3 branches, all starting in carotid triangle. That's important. All the 3 branches I drew till now, they're all present in the carotid triangle. They're starting in the carotid triangle. Let me write their name in short. This is a superior thyroid artery. I'm writing LA for the lingual artery, and this FA is for the facial artery. As a matter of fact, lingual artery and facial artery, when they originate, they are so close to each other that sometimes you may even see a common trunk for the artery. We call it lingofacial trunk. So you might have, instead of having 2 different origins, we have a common origin for lingual and facial artery, and then they later on they bifurcate. So we can have a very small trunk over there called as a lingofacial trunk, which further divides into the lingual artery and facial artery. Then we said we have one medial branch. Now that medial branch we can't see, but I'm just drawing it here for the sake of completion, guys. The medial branch, I'm just putting a dotted line here. That is an ascending pharyngeal artery. It will keep on ascending upward to the cranial foramen also. So this is ascending pharyngeal artery. It's ascending pharyngeal artery. How many till now? 4. And the 5th one is the occipital artery, which is running like this and goes all the way to the occipital region. This artery here is the occipital artery. Now guys, just look at one thing which I'm going to highlight here. Superior thyroid artery number 1, lingual artery 2, facial artery 3, ascending pharyngeal artery 4, and occipital artery 5. Out of 8 branches of external carotid, the one which I highlighted are the first 5 artery which I wrote here. If you wrote the same sequence, superior thyroid, lingual, facial, ascending pharyngeal, occipital. And the first 5 branches which we wrote here or we drew there are the arteries which are starting in which triangle? Carotid triangle. Now that's a good question to be asked. This triangle here is the carotid triangle. The carotid triangle. So how many branches of external carotid are seen in the carotid triangle? Out of 8, 5 branches are inside the carotid. One artery that you will see above the carotid, but not on the face. You still see in the neck only, but above the carotid triangle, that is posterior auricular artery. And the name is posterior auricular, so obviously the artery will be going behind the auricle like this. That's external auditory canal. You can see this is, I'm writing ECA, that's external auditory canal. So you can see it is going behind the external auditory canal or auricle. That is posterior auricular artery. Let me just give it a different highlighter because this is not in the carotid triangle. It is in the digastric triangle. And finally, the 2 terminal branches. When the this external carotid artery comes onto the facial part here, it goes through the between the parotid gland, right? And there in the parotid gland, it divides into a branch called as superficial temporal artery, and the branch going forward, that is maxillary artery. So let's say these are the 2 terminal branches. This is the maxillary artery. I'm writing MA for maxillary artery. And superficial temporal artery. I'm giving it a different highlighter now. The 2 terminal branches, maxillary artery and superficial temporal artery, will be seen coming out of the parotid gland region. Once you understand this artery in this schematic picture, then only it is possible for us to compare them with the real-time section or the atlas images. So 8 branches in total, guys. See what all questions can be formulated there. If they ask what is the first branch of external carotid? Superior thyroid. What is the only medial branch of external carotid? Ascending pharyngeal artery. What are the terminal branches of external carotid? Superficial temporal, maxillary artery. What is the largest branch of external carotid? Maxillary artery itself. Maxillary artery. How many branches of external carotid are given off in the carotid triangle? 5 branches are given off in the carotid triangle. How many branches of external carotid artery are given in digastric triangle? Now listen to this question. Given off in external in carotid digastric triangle, then answer is posterior auricular. But does it mean that digastric triangle is only having posterior auricular artery? No. You can see even facial artery and lingual artery are ascending upward through this triangle and then goes into the face. So when you count the content of digastric triangle, you have to count lingual artery and facial artery also. But if the question specifically asks which branch of external carotid starts or is given off in the digastric triangle, then the answer is only posterior auricular artery, the only branch of external carotid given off in digastric triangle. Given off in digastric triangle. Okay, once we have an idea about that where these arteries are to be expected, let's take the two major branches, guys, the facial and maxillary artery, and I'm going to start with the maxillary artery first. As you already said, it is the largest branch of ECA, the largest branch of external carotid. Well, let's understand this maxillary artery with the help of a atlas image first. Once we have a topographic understanding of the maxillary artery, then we can think about the branches. Because again, although there are 16 branches, there is no need to mug up all the branches. You can think about, okay, if this direction it is going, what will it going to supply? If it is going downward, what will it supply? So that anticipation is very much needed. Here we go. Let's use this picture, and once we understand the maxillary artery here, then we're gonna draw it separately also. We still have to discuss this topic of the muscle of mastication, so we're gonna come to that. Now, one muscle of mastication I wanted to identify here is this one, that is the lateral pterygoid muscle. It is coming from the lateral surface of pterygoid plate, having two bellies, superior and the inferior belly, and the muscle is coming backward and attached to the neck of the mandible and capsule of the TMJ. Look at that. Neck of the mandible and capsule of TMJ. Let me just highlight for you. This is the superior belly, and this here is the inferior belly of what muscle? That is lateral pterygoid muscle. It's a very, very important muscle to understand this artery. That's lateral pterygoid. Out of all the muscle of mastication, this is the only muscle which is running horizontally backwards. So if you look at this, was the we said this is the external carotid artery going in front of the external auditory canal, will give off the superficial temporal artery above. That's superficial temporal going above, and then maxillary artery will go forward. Now, guys, maxillary artery first part of maxillary artery is present deep to the neck of mandible. So it is like going behind, medial to the neck of mandible. Second part is the one which is running between the two heads of the lateral pterygoid muscle there. And third part is the one which goes into a fossa in that region called as a pterygomaxillary fissure and pterygopalatine fossa. I'll tell you. I hope you can appreciate the color there. This is the first part. This is where we have the first part of maxillary artery, where medial to, or you can say deep to the neck of the mandible. Here we have second part of maxillary artery which is present between the two heads of lateral pterygoid, superior and the inferior head. In between the two we have. Sometimes this artery even goes deep to the muscle. That's a variation. And the third part of the artery, you can only see some part of the third part here. That is in the fossa. What was the fossa, if you remember there? The fossa there was a pterygopalatine fossa, where we have pterygopalatine ganglion and all that. So the same fossa this artery is going inside, and that is the third part, which is going deep inside. First part, second part, third part, and the division is based on this. The mandible, neck of mandible, that is a muscle of mastication, lateral pterygoid, and the fossa, that is pterygopalatine fossa. Also the branches, guys, the branches that before we start writing and draw the branches of this this maxillary artery, I wanted to once again anticipate those branches. If you look at the first part, what are the close-in structures here? Just think of the close-in structures there. The close-in structure is ear. So the first part will give off the two branches toward the ear. One is called as a deep auricular, one is anterior tympanic. Let's look into the branches later. At least remember that what branches, how many branches are going where. So two branches from the first part will go to the ear. Two branches from the first part will go into cranial cavity. I'm sure you know the two branches going into cranial cavity. That was accessory meningeal artery and middle meningeal artery. Accessory meningeal, middle meningeal will come from here only, from the first part. And only one branch from the first part will come down like this and will run inside the mandible. Inside the mandible. What was the nerve present inside the mandible? That was the inferior alveolar nerve. So artery will also be the inferior alveolar artery. So we have artery going down, that is called as the inferior alveolar artery there. So 5 branches we have from the first part. 2 toward the ear, 2 going into the cranial cavity for meninges, and 1 will be going downward into mandible. And once again, you can have a pictorial understanding for that. Second part, the easiest part to remember, because second part is running on the muscle of mastication, so it is going to supply the muscle of mastication, all of them. So it will have one artery to lateral pterygoid, one artery to medial pterygoid, one artery to masseter. It will give artery to the temporalis muscle. So automatically we got 4 branches here. But it also gives a branch to the buccinator muscle. Look at that. That's a buccinator muscle. So we have one branch coming from here to the buccinator also, and that is called as a buccal artery or buccal branch. So again, how many branches from second part? 5 branches. 5 from the first part, 5 from the second part. Third part is going inside that fossa. Now think about the nerves which were coming from there and where they were going. The third part of maxillary artery will try to mimic those nerves only. Like from there, it will give an artery which will pierce the body of maxilla to go inside. So that will be the posterior superior alveolar artery. Remember, maxillary nerve was giving posterior superior alveolar nerve. This will give posterior superior alveolar artery. This will give an artery running in the floor of the orbit and coming out from that foramen, that is the infraorbital artery. Third part will also give the artery inside to the pharyngeal wall. We call it pharyngeal artery. It will give an artery inside a pterygoid canal, that is again inside. We call it artery to pterygoid canal. So just like that, I mean, the foramen, the nerves which were seen in that region, in the pterygopalatine fossa, similar kind of arteries you will see coming from the third part of maxillary artery. So when you think of first part, think of neck of mandible and think of the surrounding structures like ear, cranial cavity, meninges will be there, and below mandible. Second part is running on the muscle of mastication, so it is just supplying muscle of mastication. Third part is going to supply the internal structures, like it will give a branches to the floor of the orbit, coming to the face, going into nasal cavity, coming into oral cavity. So all the internal inside branches are given from the third part here. Let's draw it schematically and then understand the branches of maxillary artery in that. So as we said, guys, let us say this here is the neck of the mandible. Here we have the neck of mandible and the rest of the mandible. The muscle that we said is inserted to the neck of mandible and capsule of TMJ is the lateral pterygoid. So let's put this lateral pterygoid here. I'm not drawing the two separate belly. Let's say this whole muscle is lateral pterygoid only. So here was the first part. Where is the first part? It is deep to the neck of mandible. That is the first part over there. Second part between the lateral pterygoid. There we have it. And third part was ascending and going into that fossa. What was that fossa? That was a pterygopalatine fossa. There is a fissure below and then there is a fossa above. I'll tell you. There is a fissure. First there is a fissure and then we have a fossa inside. The fissure is called as pterygomaxillary fissure. This is called as pterygomaxillary fissure and the fossa is called as pterygopalatine fossa. Not pterygopalatine fossa, pterygomaxillary fissure and pterygopalatine fossa. The first part, the second part, and the third part. So I don't think I have to write it down separately. You already would have understood the first part medial to or deep to the neck, second part lateral pterygoid, third part is in the fissure and fossa, pterygomaxillary fissure and pterygopalatine fossa. Okay, now let's take our focus to individual part. Let's pay attention to the first part here, guys. So I'm going to draw only this small region here so that by the direction at least you remember those branches here. So just to remind you, first we said first part second and third part. First part, how many branches were there from the first part? We got 5 branches from the first. We got 5 branches from the second. And there are 6 branches from the third part. which accounts for total 16 branches of maxillary artery. That's how we got 16 branches, 5, 5, 6. So let's take on the first part. I'm purposely drawing this neck of mandible a bit thicker and broad here. This is the neck of the mandible, and here we have the maxillary artery. The first part, right? So we can say two branches from the first part will be going toward the ear. One is supplying the tympanic membrane, outer part and external auditory canal, and one is supplying the tympanic cavity or middle ear cavity, and that's how they're named. One is called as the deep auricular artery, and the other one is called as an anterior tympanic artery. See, if you remember these kind of things here itself, so when we'll discuss the blood supply of the middle ear or external auditory canal, the things will become easy for us. We already heard of these branches. Deep auricular. Look at the name, deep auricular. So obviously, when you say the word auricular, you cannot talk about the middle ear or internal ear. It's from outside only. Deep auricular means it is supplying the deeper part of external auditory canal. And while supplying the deeper part or the inner part of external auditory canal, they also supply the outer layer of tympanic membrane, outer one. So deep auricular artery is the one which is going to supply inner aspect of external auditory canal, number one, inner aspect of external auditory canal, and outer layer of tympanic membrane. And outer layer of tympanic membrane. Make sense, guys? Auricular. The word is auricular here, and it says deep auricular, so it's deeper inside the auricle. Anterior tympanic, anterior part of middle ear, which is, you can also say, outer part of middle ear. Anterior tympanic artery supplies middle ear cavity. Let's just simply say middle ear, some part of middle ear, and along with that, inner layer of tympanic membrane. Inner layer of tympanic membrane. Well, of course, if it is supplying middle ear cavity, it is having a inner layer of tympanic membrane is the one which is facing it, the middle ear, so that is supplied by it as well. Inner layer of tympanic membrane and middle ear cavity. That is deep auricular and anterior tympanic. Then we said two arteries which will be going above. One through foramen ovale, and the major one is going from the foramen spinosum. One is going through the foramen ovale, I'm just drawing their shape, and one is through the foramen spinosum. From the foramen ovale, we got accessory meningeal artery along with other three structures. Accessory meningeal artery, and foramen spinosum is obviously giving passage to the middle meningeal artery. So we got two artery for the ear, we got two artery for the meninges. And finally, the only branch from the first part which goes downward in the mandible, runs inside the mandibular canal, and just like the nerve, this artery also comes out through the mental foramen later on. That is inferior alveolar artery. So these here are the five, and this, as I said, it ultimately comes out as what artery? It comes out as the mental artery of the mandible. So these are the five branches from the first part of maxillary artery. Two for the middle ear, two for the ear, I should say, two for the meninges, and one for the mandible. And just like inferior alveolar nerve, if you remember the branch of mandibular nerve, just like inferior alveolar nerve, before going inside the mandible, gives off nerve to mylohyoid. Same story. Inferior alveolar artery, before going inside, gives off a branch downward that is called as artery to mylohyoid. No harm in drawing that also. I can put that detail also. This inferior alveolar artery also gives off the artery to mylohyoid. Every single thing that we're discussing here will be of use somewhere or the other. Maybe in the triangles of the neck, maybe when we'll talk about the, the ear, then you'll understand these arteries better there. We already talked about the middle meningeal and accessory meningeal supplying the dura mater. So you have use of every single artery to be discussed. That's the first part, guys. If somebody is a fond of mnemonic, so there's a mnemonic for this as well, and that goes like ADMI, Aam Admi. Aam Admi. The 5 branches from the first part can be remembered as Aam Admi. Well, one is accessory meningeal, one is anterior tympanic, one is deep auricular, one is middle meningeal, one is inferior alveolar. So Aam Admi, you remember. Second part. Coming to the second part. As I said, second part is the simplest one because second part only supplies the muscles, so it just gives off the muscular branches. Let's see what those muscular branches are. Well, first we have artery to medial pterygoid. Then we have artery to lateral pterygoid. We have artery supplying the masseter, we call it masseteric artery. The artery which supplies the temporalis muscle. See, temporalis muscle is supplied by the arteries not from the outer surface but from the inner surface. If this is my temporalis muscle, you will see the branches of maxillary artery not present outside but on the inside here. So we call them deep temporal arteries. So we have deep temporal arteries supplying temporalis muscle. Deep temporal artery to which muscle? To temporalis. So we got all the muscle of mastication covered: medial pterygoid, lateral pterygoid, masseter and temporalis. Still 4. Fifth one we said it is a buccal artery. Fifth one is the buccal artery, which is going to supply what muscle? It supplies the buccinator muscle. I hope you know buccinator muscle is also called as accessory muscle of mastication. It is a muscle of facial expression surely to inflate the cheek, but this is also called as an accessory muscle of mastication. And why do we call it accessory muscle of mastication? Because this helps in the inflation of the cheek, and that will help the tongue to clean the food from the vestibule. Like you can run your tongue like this in the vestibule region. That is because buccinator muscle can inflate, and that will allow the tongue to clean the food from the vestibule here. So while chewing, the food will go into the vestibule region and the tongue can bring it out and again push it between the teeth for the churning. So it is called as an accessory muscle of mastication. So 5 branches from the first part we saw, and now we're looking at 5 branches from the second part, which is pretty simple. They are all muscular branches. And then comes the third part, which we got to discuss a bit. Third part branches, we have 6 branches, and it's better we use a mnemonic here, guys. The mnemonic here goes like pig pass. Pig pass. And the advantage of this mnemonic, I would say, is this will help you to remember the branches in a sequence. PIGPAS. In that sequence, the branches will be seen coming out of the third part. Pig pass. Let me write the branches and we'll discuss few of them in more detail. Like P stands for posterior superior alveolar artery. Just like we have posterior superior alveolar nerve, we have posterior superior alveolar artery. Just like we have infraorbital nerve, we have I for infraorbital artery. Same location. Infraorbital artery, which will be running in the floor of the orbit and will then come out from the foramen below the orbit, that is infraorbital foramen. So infraorbital artery. G stands for greater palatine artery. Now let me tell you a bit more about greater palatine artery before I write the rest of the branches. Guys, what is this greater palatine artery? What's the speciality of the greater palatine? I mean, let us say you're looking at this nasal cavity, that's a nasal septum here, and here we have the hard palate. If you look at the hard palate, in the posterior part of hard palate, we have greater palatine foramen and we have a lesser palatine foramen. There's a foramen called as a greater palatine foramen, which is more anterior, and just behind that we have lesser palatine foramen or foraminae. It could be multiple small lesser palatine foramen. So this maxillary artery The third part of maxillary artery, as I said, gives off the greater palatine artery, which will come down like this, goes through greater palatine foramen, runs forward under surface of hard palate, and then enter through the incisive fossa to reach the nasal cavity. So there's an incisive fossa there. This is greater palatine foramen. Greater palatine foramen. So you look at this, the greater palatine artery, I'm writing GPA here. The greater palatine artery comes down, goes out through the greater palatine foramen, then obviously running forward, supplying the undersurface of the hard palate, it is supplying all the mucosa and glands in this region, will reach the nasal cavity, and ultimately on the nasal septum, it contributes to the Little's area. It is one of the contribution to the Little's area. So again, guys, we'll be discussing the Little's area in the nasal cavity, in the nasal septum. But from here, at least you should remember this artery, that how it reaches there. The greater palatine artery from the undersurface of the palate, using the incisive foramen just behind the incisors, it goes into nasal cavity. We call it greater palatine artery, so there must be something called as lesser palatine also. Lesser palatine artery is nothing separate, it's a branch of greater palatine only. Lesser palatine artery is a branch of greater palatine which will come out of this lesser palatine foramen, and then it goes posteriorly. And what is there if you think about behind the hard palate, what is there to be supplied? We got a soft palate there, and on the side we have palatine tonsil. That's why this lesser palatine artery, I'm writing LPA, lesser palatine artery, which is a branch of greater palatine, is going to supply the soft palate and palatine tonsils. Lesser palatine artery is going to supply the soft palate and palatine tonsil. You know, the same is with the nerve also, greater palatine nerve and lesser palatine nerve. Whenever you say greater palatine, think about these structures are going forward. And if they go forward, they can enter into the nose also. Lesser palatine nerve, lesser palatine artery, they will go backward. If they go backward, they're going to supply soft palate, and on the side of the soft palate below that we have palatine tonsil. So this lesser palatine artery is going to supply soft palate and tonsil, greater palatine, hard palate and nasal cavity. Right? So that's a little about this branch called as greater palatine artery. Pig pars, PAS. The next here is the pharyngeal artery. Pars, that is the pharyngeal artery. This pharyngeal artery supplies the upper part of the pharynx only, just few direct branches to the upper part of the pharynx. PASA. A is artery to pterygoid canal. Artery to pterygoid canal. If you remember the nerve to pterygoid canal, guys, nerve to pterygoid canal, which was a combination of greater petrosal and deep petrosal nerve. Similarly, we have artery to pterygoid canal, and that's why the artery to pterygoid canal is also called as the Vidian's artery, because that was a Vidian's nerve. So this is also called as a Vidian's artery. And lastly, and definitely one of the most important branch from the maxillary artery is this S. S is for sphenopalatine artery. Sphenopalatine artery, and it is to be noted that sphenopalatine artery is the largest branch of maxillary artery. Be it first part, second part, whatever, it is the largest branch of maxillary artery. Maxillary artery was the largest branch of external carotid, and maxillary artery's largest branch is the sphenopalatine artery. This sphenopalatine artery is a major arterial supply to the nasal cavity. This is also called as the artery of epistaxis, artery of nose bleeding. Also called as the artery of epistaxis, artery of nose bleeding. So this tells us about the branches, guys. The 16 branches of maxillary artery. 5 from the first part, 2 for the ear, 2 for the meninges, 1 for mandible. 5 from the second part, 4 for muscle of mastication, 1 for the buccinator. And 6 from the third part, the pig pars branches, which I said will be more inside. It's not easy to visualize them from the outside. You can least expect a image-based question from the third part of maxillary artery. But yeah, first part they can. First part especially they can.